Welcome to our channel HASHMICLINICS.
All right, welcome everyone. Today we're diving deep into a really fascinating remedy, Ammonium Causticum. What's so interesting about it? Well, it's a remedy of incredible contrasts. On one hand, it can act with lightning speed in a life or death emergency. But on the other, it points to a very deep underlying constitutional weakness. And getting a handle on that duality, that's really the secret to using it effectively in your practice. So let's start with a clinical puzzle, something we all face. Picture this, a patient in a state of sudden collapse, just complete, overwhelming prostration. What remedies jump to your mind? The ones that can act like a cardiac stimulant, something to really jolt the vital force back into action? Thinking about this really brings us right into the heartland of Ammonium Causticum. Okay, so here's the absolute core of it. The entire picture of this remedy, everything it does, it all stems from one single aggressive action. It's a powerful irritant, a caustic irritant. If you just grasp that it causes swelling, ulceration, and even bleeding on mucous membranes, then honestly, the rest of its symptoms just logically fall into place. It's the master key to understanding this remedy. So here's how we're going to break it all down. First, we'll get into the real essence and core action. Then we'll look at the mental and general picture to understand the patient. After that, we'll hit the really juicy stuff, the keynote respiratory and throat symptoms. From there, we'll see how it shows up in other body systems, touch on how to apply it clinically, and finally, we'll wrap up by comparing it to some other remedies and sharing some key takeaways. Sound good? All right, section 1. Let's get right into the essence and the core action. What is this remedy all about at its most fundamental level? Okay, this right here, this is the nucleus of the remedy. Think of these 5 points as the core signature. You've got the swelling and ulceration of mucous membranes, that intense pervasive burning, bleeding from pretty much anywhere, and then this absolutely profound exhaustion. And top it all off with a sudden, total loss of voice. When you see this cluster of symptoms, this local destruction paired with a whole body collapse, you absolutely have to think of Ammonium Causticum. And this is so crucial to remember. Physiologically, it's a powerful cardiac stimulant. And what does that mean for us in the clinic? It means it's an incredible tool for the most serious emergencies. We're talking about things like fainting, blood clots, severe hemorrhage, and even toxic shock from snake bites. In those moments where you need to rally the vital force and you need to do it fast, this remedy can literally be a lifesaver. Okay, so we've seen the acute picture. Now let's zoom out and build up the constitutional picture. What does the Ammonium Causticum patient look like, mentally, emotionally, and in their general physical state? Now, this is really interesting. The mental state is all about duality, a real contradiction, which is often a huge clue for prescribing. On one side, you have this deep-seated timidity and anguish. They're easily frightened, they get startled. But then, on the complete opposite end of the spectrum, you have this intense excitement and restlessness, especially in the evening and at night. It's this internal push and pull, this tension, that's such a vital part of the whole picture. And these physical generals, they're present in both the acute emergencies and the chronic picture. And when we talk about exhaustion, it's not just feeling a bit tired. We're talking about a deep, profound weakness in the muscles, the kind of debility that can actually lead to collapse. And you'll often see this alongside a body that just can't regulate its temperature properly. So they might have hot, dry skin, or they could be shivering with chills. Okay, now we're getting to the absolute heartland of this remedy. This is its signature territory, the throat and the respiratory system. This is where Ammonium Causticum really, really shines, with its most unique and dependable symptoms. And here it is. If you remember one thing, remember this. Burning rawness in the throat. This is the grand keynote. It's not just reliable, it's often the one symptom that confirms the whole case. And we're not talking about a simple sore throat here. No. Imagine the feeling of a surface that's been scraped completely raw and then had something caustic poured on it. That's the sensation. It's intense. So look at how quickly an acute crisis can unfold. It starts with that scraping, burning feeling in the throat and esophagus. Then boom, suddenly the voice is completely gone. Total aphonia. From there, it gets really serious. The coughing is nonstop, mucus builds up, and then you get a spasm of the glottis. The patient is literally gasping for breath, feeling like they're suffocating. It's a terrifying, life-threatening situation. So let's be really clear about the aphonia here. It's not just any old hoarseness. The key is the totality. It's a sudden, complete loss of voice, and it comes packaged with that deep, burning rawness we talked about and that profound debility. You put those three together, and you have a powerhouse indication. This is why it's such an amazing remedy for people who rely on their voice. Singers, teachers, public speakers who suddenly lose their voice and absolutely need to get it back fast. All right, let's widen our lens a little bit. We've seen the throat, but how does this caustic action show up in other parts of the body? Because the core problem, that irritation, it stays the same, even if the symptoms look a little different depending on where they are. This table really lays it out nicely. You can see how that core pathology just ripples through the whole system. In the gut, you might see white patches on the tongue or cheeks. In the urinary system, it can get serious. Acute kidney inflammation with protein and casts in the urine, a sign of real kidney stress. That tendency to bleed, it's systemic. They can bleed from anywhere, and it makes them feel faint fast. And that overwhelming weakness we keep mentioning, it shows up in the muscles and joints as a kind of rheumatism, especially hitting the big muscles in the shoulders and thighs. Okay, section 5. Now this is super important for accurate prescribing, knowing what makes the patient worse. We're going to cover the key modalities, and then we'll pull together a list of the specific clinical situations where you should be thinking about this remedy. The modalities here are actually pretty simple, but they're clinically huge. There's a major aggravation. Things get much worse after eating and after drinking. Basically, anytime something passes down the throat, that burning and pain just flares right up. It's a really solid confirmation when you see it. And look at this list. It really shows you the incredible range of serious conditions where this remedy can be a game changer. We're talking life-threatening stuff like membranous croup and heart failure, all the way to massive bleeding, poisonings, and deep inflammatory states like nephritis and ossifitis. Its sphere of action is just so deep and so versatile. All right, we're in the home stretch. To wrap things up, we're going to put this remedy in context. We'll compare it with its closest cousin so you don't get them mixed up, and then I'll boil everything we've talked about down into a few practical, easy-to-remember tips for your practice. Okay, this is a really important distinction. Ammonium causticum versus ammonium carbonicum. You've got to know the difference. And the key is all about intensity and pace. Think of ammonium causticum as fast and violent. It's got that intense, caustic burning, and it leads to a sudden, dramatic collapse. Ammonium carb, on the other hand, is, well, it's slower. The patient is exhausted, sure, but it's more of a drowsy, sleepy state, often with that rattling in the chest. It's just a less acute, more congested picture. So let's wrap it all up with 4 prescribing pearls to take with you. Number 1, always think of violent, rapid, burning destruction. That's its signature. Number 2, memorize this keynote triad. Loss of voice, burning rawness, and total exhaustion. It's gold. Number 3, anytime you have a case of acute collapse, whether it's from fainting, shock, or a bite, this remedy has to be on your short list. And finally, number 4, don't forget the patient behind the crisis. Even in these violent situations, the underlying person might be quite timid and easily startled. So I'll leave you with this question to carry into your clinic. The next time you see a patient who's suddenly lost their voice and is collapsing in front of you, what's the one question you're going to ask? Ask about the pain in their throat. And if they tell you it feels like a burning rawness, well, now you know exactly which powerful, fast-acting remedy needs to jump to the very top of your list.
Professor Dr. Rafat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rafat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.